Thank you.
Secretary, Director, thank you so much for your patience. I think we may hit a record of over a 4-hour hearing here at the rate we're going. We'll see. I want to get a couple things on the record. To say that Medicaid expansion will invest billions of dollars into the economy, I think is unfair perspective. When the Affordable Care Act came into fruition, it was a double-digit number of taxes that came in to pay for it. The federal government, again, had another tax increase, the payroll tax, in January. One of the first agencies that came before us was the Independent Fiscal Office, and we have sluggish sales tax. Why? Because of the payroll tax. We have a free market economy where if people don't have money in their pockets to spend, the entire system breaks down and you start shifting over to more government control, more socialist behaviors. If you want to continue a free market economy, the economy that made America and Pennsylvania the greatest nation in the history of the world, you need to return people money, keep money into the hands of the individuals, to the taxpayers. To say that we're taking money from the people, redistributing around to say we're going to reinvest billions of dollars into the economy is just not a true statement. It takes money out of the economy and doesn't allow the economy to expand through the natural course of economics. So I think it's not fair to say that we're going to see a huge economic boom if we do Medicaid expansion. It's just not going to happen because we've already seen a tightening of the economy. We have an inept federal government that is borrowing money to pay their bills, which is just a deplorable economic sense to begin with. So to move forward, it's not wise to just jump into this Medicaid expansion. Now I want to hit a couple of these governors that have said they're leaning or approving. Now a lot of them are working with CMS to get more flexibility. Are you aware of what flexibility they're getting from the federal government currently with their agreements?
We have been reading every article. We've been in touch with my counterpart in Virginia. I've been talking to him pretty regularly. A lot of the things that they're asking for, Pennsylvania already does. Okay. So again, that's why I said you can't compare Pennsylvania to the other states. So we are looking at everything they're asking. And again, with flexibility, with reform, we will have, as we ask those questions, we can come back to you with those answers, which will help Pennsylvania to make a good decision for Pennsylvania.
Yeah, I think that's very important moving forward because I think the flexibility those states are looking for, we already have and implemented. So we're on the right track already. Yeah. And we have to look at the overall fiscal impact. If you do the expansion, it's an increased cost. Where do we make up for those dollars? My previous colleague was asking about cost drivers of Medicaid expansion. You're talking senior citizens. Huge cost driver moving forward. The governor put up a plan to strengthen the lottery system to provide stable and increasing revenue to help cover that. What happens if we don't get more community-based services for seniors rather than the continuation of Medicaid services? What do you think will happen in the long term with that?
Well, with that, we are looking, certainly, because we want to ensure, we're a state with a high growth of seniors in our population. As we move forward, we absolutely have to address that. Us baby boomers, me being one of them, are going to get to that stage pretty quickly. So we need to have a continuum of services. Whenever people can remain in their home and communities, that's what we want to see. That's the right thing. Even though we're always going to need nursing homes, we're going to always need other levels of care. We're looking right now, because of the concern whether the dollars from the lottery will be there or not, we're going to keep looking to see, is there another way to make up those dollars, if there is another way, and we'll do the best we can.
I know you'll do great. I know you were a huge advocate for community-based services as a legislator.
Absolutely.
When you were Director of Human Services at York County. I know that was a great passion of yours, and you saw the cost savings long-term of doing that. So I do appreciate that. I guess my next question, your previous secretary was a big fan of trying to get block grants coming down from the federal government. Are we still looking at trying to get more flexibility from the federal government through block grants?
One of the things, Representative, we are looking for, if we move down the road to looking at any kind of expansion, waivers. We have, 12 waivers. It would be nice to consolidate, to streamline a little bit more, to make a lot more sense for the people of Pennsylvania. So that is one issue that we will look at. Most states do not have near those number of waivers, so we think that would be very helpful. We are not looking to move forward with like one block grant from the feds.
Mm-hmm. Good. Appreciate that. And final question, when's the governor going to make you the official secretary?
Are there any?
You don't need to answer that. Thank you. Thank you, Mr. Chair.
Thank you, Representative.